Hi, my name's Elaine Valentine, and I'm the Director of Psychological Health at March Air Reserve Base. Well, I started out as a pediatric social worker, and I worked at Rady Children's Hospital in San Diego. And then I relocated to Seattle, and I worked at Seattle Children's Hospital, and I lectured at the University of Washington. So from there, I got interested in working for the military because we had a case that involved the military with a child who had a pretty significant pediatric condition. And I got to go to Madigan Army Medical Center for a conference there, an actual case conference on this particular child and family. And I saw that there were so many other avenues that I could work in and be effective in, and I started becoming more and more interested in that. I felt that I could provide a lot of good services for them. I had skills in the areas where I felt that there was a need. Crisis intervention. I saw opportunities that I thought they could benefit from, and I knew that I could be effective in the kind of work that I was doing. I have a passion for working for families and with children and those in need. And when I saw that the military had some additional stressors, more stressors than in the private sector, that really intrigued me in how I could help them get through those stressors, and the families as well, because those stressors would include the relocations, the moving to Europe or moving to Asia for assignments, or it would include going to trainings and families not being able to get together all the time, and having to cope with those separations were really challenging. And so I wanted to be part of their solution to not feeling as isolated or feeling that they had to take care of things by themselves or not having sufficient resources. I think across the board, there's always a work-life balance. The military has to be mission ready. And so with being mission ready, you have obligations that you have to fulfill when you're in the military, and sometimes they don't include your family the way that you would like for it to include your family. And so families worry, and sometimes there's crisis around those families. Sometimes life happens at home when the military member isn't at home. Sometimes it happens with a military member while the military member is deployed, or sometimes it just happens because it's part of life. Life doesn't stop just because you're in the military. I'm available to everyone. I never prioritize. If I prioritize according to the acuity, of course, because you want to keep people safe. But I see military members, I see family members, I see retirees, I see our civilian workforce. We're all supporting the military. And so it's important to know that if you're part of the military family, you're just as important as anyone else. The Director of Psychological Health offers a variety of services, and the reason individuals seek these services vary. But typically the services that we provide are crisis intervention, individual and couples counseling, group work, resource and referrals. And it's a variety of ways that individuals come to me to find out what these services are. Oftentimes it's through a phone call, oftentimes it's a referral from a commander. Sometimes I have walk-ins, individuals who just find my office, but I always try to ensure that they know where I'm located and where I'm located, and especially that I'm always accessible and available to them. I always return phone calls, and I always try to find a resource for them no matter when they call me, because it's very important that they feel that they're being listened to. Well, I think sometimes there's some stigma around seeking psychological health services, but I always explain to individuals that it's about psychological wellness and mental fitness, that we work together with other subject matter experts that are involved in the comprehensive airman fitness program, which is mental fitness myself, it's physical fitness, it's social fitness, and spiritual fitness. And so when there's an imbalance in one of those domains, the other domains suffer. And so I always try to explain it in those terms, that it's about wellness. It's not about having something wrong with them. It's that there's been an imbalance and we want to get them back into balance. Sometimes individuals come to see me because they want to just vent or they need a listening ear. Sometimes it's because they're stressed out over work, or sometimes there's stress in relationships. And usually people come to see me when there's a tipping point, and they don't need to wait till there's that tipping point. My services are confidential, they're free of cost. I can see them as often as they would like to come and see me. And I'm always receptive to find resources for those individuals who are in crisis. But the bottom line in my job, I have confidentiality in my job, so I don't document as well. And what we talk about stays in my office. I am a mandated reporter, so if someone discloses that they are thinking about self-harm or harming others, or they disclose child maltreatment or sexual assault, I do have to report that as a mandated reporter. I think the enjoyment of what I do is what drives the train for me, because I truly, truly want to help those who don't feel that they have other avenues where they can be helped. And I have always had that skill to assess quickly and listen and know where to go to get some help for somebody. They can call my office at 655-5097, or I'm in building 317. My flyers are out. They're in every squadron.
Okay.
And I can certainly go to people if they don't want to come to my office. I can also do sessions on the phone if they don't want to do it any other way. I think it's important that they know that it's safe. And safety is a big issue in getting help, because usually when someone comes to see me, they feel that they haven't been able to take care of it themselves. And so I'm always honored and appreciative when someone calls me and wants to take the time to talk to me and entrusts me with their trust in being able to help them. That's really important, because life happens to everyone, regardless of rank, position, privilege. And so no one escapes it completely. And so it's so important to understand that and to know that no one has to cope with things by themselves, that there's always me that they can count on to assist the best that I can for them. So in closing, I just wanted to say that in the military we talk a lot about situational awareness, and situational awareness means being aware of yourself and being aware of others. And part of my passion is being aware of others and getting to know what the real story is and listening to what that is, so that I can move forward with them in a way that's going to be positive for them. And by doing so, we're able to practice connectedness, because connectedness is one of our protective factors. Know your airmen, know the people that you work with. As much as I try to get to know them, my passion is to get to know people so that I can help them. You're around them more than I am, so get to know them as much as you can. Because Suicide Prevention Month is the month of September. The theme is connectedness. The slogan is connect to protect. If you connect to protect, you'll always be aware that life does happen and it happens unexpectedly, or sometimes it's cumulative. But by knowing someone and having that situational awareness around you, you might be the one that someone will call as a lifeline.